Hello, good morning, all of you. We are going live with Sami Mansfield, a very interesting presentation on metabolic health and lifestyle medicine. But before we do that, let me introduce Fiterobic. Fiterobic is a health tech company which is headquartered in Mumbai, India. We work with experts in the field of lifestyle medicine. We have created a platform where experts can come and share their expertise, and together we take this cause of helping people stay a healthy and fit life and also live a fulfilling life. You can always obtain more information by visiting our website. That's Fiterobic, that's Fiterovic.com. And I am Alok Ranjan. I am the founder and chief Fiterobic. Let me introduce today's speaker, for which all of us are awaiting. We have Sami Mansfield, who is an oncology, wellness, and exercise specialist. So without much ado, let me bring Sami on stage. We will be running polls from time to time during this presentation, and we will ask questions. After the 40 minutes of presentation, we will also do a Q&A where we will answer all your questions that you may have. Thank you so much for joining today. And over to you, Sami, for the presentation.
Hello again. Hi, everybody. Thank you, Alok, for inviting me. For those of you that don't know me, as I mentioned, and as Alok has mentioned, I have been working in the lifestyle medicine category for quite a while through various capacities. But I am really interested in tonight talking about metabolic health and what that means, and then applying it through some of the intervention strategies. For those of you that know me, that I'm an exercise oncology by training. I want everybody to sit up straight. Make sure you pull your belly buttons in there for 1 second. Let's make sure that everybody is getting their core engaged. So what are we going to talk about tonight? And today, wherever you are, we're going to talk about metabolic health and lifestyle medicine. But of course, we're going to definitely talk a little bit about the cancer side of things, and then really focus here on implementation. So our highlights today are, talking about what is metabolic health? Why is this such a confusing topic? I think that one of the biggest things that I believe strongly is that people don't understand what is metabolic health, what does it mean, how does it apply to me, where does it apply in the cancer space. So we're going to get into that, talking about cancer and chronic disease and where metabolic health applies here. And then really talking specifically about some of the factors to measure metabolic health. And then we're going to talk about the implementation side of this, lifestyle medicine being one of those platforms, but some of the other resources that are really important. So if we can go into the next slide, this in my mind is the most important in the next piece. Yep, perfect. What is metabolic health? This is why we are all here. So first of all, I want to really take a moment to set the audience for this talk. First of all, we have a global audience. As you heard, Luke is based in India. I am currently outside of the United States, but my home is in the United States, and we have people from all around the globe here. So, by definition, we're all going to look at metabolic health a little bit differently, as well as we describe different terminology that fits who we are as healthcare providers, fitness professionals, nonprofit, physicians, whatever that may be. But at its simplest, metabolic health is, as you can see, is defined as how effectively we as humans generate and process energy in the body to support all of our functions. It seems so simple when we think about it, but I think people don't really understand why it is so confusing. So metabolic health regulates so many systems. One of the main systems that metabolic health regulates is cellular repair. So what does our cellular repair process look like, and why is that so important? Well, first of all, I want you to think about a single day. So if you think about the last 24 hours of your life, you've had 330 billion cells replaced in your body. This is actually only 1% of your cells. And in actually 90 days, we will replace about 30 trillion cells, which means we get a whole new body. This is all regulated by our metabolic health. So the healthier we are metabolically, the better the cellular process is. We also note that metabolic health regulates a lot of our autonomic processes, thinking about things like respiration, digestion, heart rate, all of those things. And then things that are really important to us individually, such as or like our focus, our sleep, how we feel in our energy. So have those days that you feel sluggish. That is on the board. So there are 4 areas that I want to talk about with where we see metabolic health and what I call the real world. These are not necessarily the only 4, but I think anybody that's attending this webinar or sees this topic can relate to these 4 areas. So as an example, one of the first ones to think about is our metabolism. Well, our metabolism we think about as the way that we regulate our body weight or body composition. I've also heard people, and I've said this, I have a slow metabolism or a fast metabolism, but metabolism really is the chemical reactions of our body and how we take in nutrition and we utilize it for energy, brain, organs, whatever that may be. Okay. So it's really at the fundamental core how our body takes in the food and creates energy for our muscles and our brain. We also know that metabolic health is identified related to obesity. So I think this is really important that I don't want people to think that this is really a simple topic. I'm going to glaze over this quickly because honestly, we could do an entire discussion on metabolic health related to obesity. But I want to talk about this as more than calories in and calories out and weight. Obesity in the metabolic health setting is actually kind of a symptom. So people that are less metabolically healthy, which we're going to talk about, are more predisposed to being obese, having higher muscle or higher body fat and lower muscle mass. So there's a lot of inflammation factors here related to obesity and body composition, but it is also, again, a symptom of poor metabolic health. In the clinical setting, we also utilize what we know as metabolic syndrome. So metabolic syndrome is a cluster of different diagnoses that actually show risk factors of certain diseases, such as diabetes, heart disease, stroke, neurodegenerative diseases, as well as cancer, some types of cancer specifically related to, again, obesity or body composition. Metabolic health is actually known to be present in about 1/3 of adults, but these are old numbers from 2018, and is defined by an individual having 3 of 5 criteria: a waistline or waist circumference of more than 35 inches for women, 40 inches for men, high fasting glucose, high triglycerides, high blood pressure, and low HDL or good cholesterol. We know that, again, metabolic health is a precursor, but at the end of the day, I think it's also important to say that we aren't testing and assessing most people for metabolic health. So I would guess that this number is actually higher. And then lastly, and I think people are really surprised to see this little image of this is actually one tiny little muscle fiber if you take like your bicep or your thigh, you actually have thousands of these little fibers that look like ropes in your muscle, okay? But in healthy fibers, all of these are red. This actually is an image of low quality muscle where muscle mass actually has fat infiltration. This is it is a marker of poor metabolic health or something that we see in people that are obese or have metabolic syndrome. So why is skeletal muscle so important? Well, skeletal muscle is something that we all know is really important for us for function. It regulates our metabolism, as we talked about, kind of in that top left corner. But one of the things that I don't think people really understand is that poor quality skeletal muscle is actually an indicator of poor metabolic health, but poor metabolic health contributes to poor quality skeletal muscle. Skeletal muscle, like I said, manages function. Skeletal muscle is also an entire organ system known as our endocrine organ system and is the biggest disposer or utilization of glucose or sugar in the blood as used to the muscles. So again, kind of a simplistic way to describe it. But do you know those days where you eat something really sweet or you have that really big bowl of ice cream or that dessert and you can tell that you have that high blood sugar? It's important that you have a lot of muscle because your muscle is what is responsible for helping bring that blood sugar down. So if you have poor quality skeletal muscle or metabolic syndrome, it's harder for you to utilize that glucose. In the cancer setting, this is also important to understand the quality of muscle because muscle actually secretes something known as myokines. These are just little fancy things that are helpful to regulate metabolic pathways on our immune system and regulate our immune system. And we understand why skeletal muscle and the creator of these myokines actually is important in how our bodies work and these metabolic pathways that are cancer regulators. So more muscle mass is important in the cancer setting, both in risk reduction, but also managing disease. Let's go ahead and go to the next slide. Let's get beyond the science and move on to the fun stuff. So we want to talk about also what is the current kind of lay of the land? Great. So this is where I want the rubber meets the road in what the science is, and then what are we going to do about it, which is where I want to spend the most of our time here today. So what do we know? Well, remember I talked about metabolic health. We know that only 12% of adults are considered to be metabolically healthy. And this is really surprising. The number one reason I think that we see this high number of unhealthy or poor metabolic health is largely related to obesity in our world, not just the United States, but again, talking from a global audience. But all of these other factors, we know that 11% of adults have type 2 diabetes, which is 90% of our diabetes that is diagnosed across the world, and 38% of adults have pre-diabetes. So again, going back to that high fasting glucose, we know that almost 40% of adults, I would say this is probably a little bit higher now, actually already have pre-diabetes. And again, that's one factor of metabolic health, but not the whole picture. So I just want to throw in the snapshot of now that we have this kind of horrible facts to think about how unhealthy we are, what do we do about it? Well, there's three goals that we're going to kind of talk about here and as we get into the lifestyle medicine side of things, but I want to just start dropping these in here for importance. One is we need to add and maintain skeletal muscle. Remember, as I mentioned in the previous slide, skeletal muscle is one of the most important factors and is actually something that is very controllable. Not all factors of our metabolism we can control. As we age, our metabolism changes, but we can always put more muscle on our body through health and active lifestyle. I'm also going to talk through our lifestyle medicine pillars that we should emphasize a whole food, plant predominant, and adequate protein based diet to have that important skeletal muscle. And then, of course, we want to achieve or maintain a healthy body composition. So, body composition being skeletal muscle related to our body fat. And again, it's having enough muscle, not just low body fat. All right, if we can go to the next slide, that would be great. All right, I want to take a moment before we go into the fun implementation side to talk about where does cancer fit into this? Because as most of you may know from this slide and hearing a little bit about my background, my role has been in cancer. I've worked in this field for close to 21 years. And I started off as a cancer exercise specialist, thinking that exercise was the most important thing, not necessarily to improve survival, but just quality of life. I wanted people to live better, to function better, to have more energy, but we didn't really have science related to exercise 21 years ago. What do we know now? Well, before we talk about exercise and inactivity, which is on the right, keep your eyes on the left for a moment and let's kind of frame what we've talked about with metabolic health to where we're going to move forward in lifestyle. What do we know now? Well, we currently know that 13 cancer types are linked to obesity. Again, just thinking about generally body composition and some of these other probably metabolic health things that we can't always define. We actually expect that this number is higher now, closer to 15, maybe 16 types of cancer. This is not just the breast, the colorectal, the prostate. This is also related to some of our blood cancers. This is related to pancreatic cancer. We are seeing obesity related to non-Hodgkin's lymphoma. It isn't just the traditional weight related cancers. We know that 4 in 10 cancers are linked to modifiable risk factors. This is also things like tobacco and smoking, of course, but we also know that inactivity and obesity and not having enough fiber in our diet are also linked to increasing our cancer risk. And again, this is still correlation, not causation, but we know these are lifestyle habits. We know that that metabolic syndrome that I talked about just previously, the cluster of symptoms increases our cancer risk, and that cancer survivors have an increased risk of chronic disease and worse outcomes. And this is related to metabolic syndrome not only coming in the door, but we know that individuals with poor metabolic health actually respond to treatments differently, especially our immunotherapies. So we know that metabolic health, although we can't always articulate exactly A, B, C, D, we know that it is important to how our cancer patients go through treatment as well as their overall survival. So let's hone in on one of our pillars here and kind of put the pieces together with skeletal muscle, metabolic health, and cancer. So this image is from a research study that we'll share with a follow-up part of this presentation, looking at physical activity, obesity, and sedentary behavior. So don't worry for a moment about striving to meet exercise recommendations. I'm actually not even going to really talk about that through this talk, but thinking about one simple action, which is activity or inactivity. So we know that the more inactive we are, right, the more time that we spend behind our computers or doing sedentary time, whether that's watching TV or Netflix, reading, doing arts and crafts, if you like to do those kinds of things, whatever that is, the amount of time that we are inactive actually can contribute to our cancer risk, because the inactivity decreases a lot of our metabolic function, allows our muscle to actually atrophy or kind of dissipate over time. And it creates an environment that increases inflammation in the body, and it creates things like low grade inflammation, right? So we know that this metabolic health piece can be influenced by something as simple as physical activity or inactivity. So I think it's really important to understand that I'm not saying everybody needs to strive to meet exercise recommendations to prevent cancer, but if we just focus on lifestyle and behavior change, such as reducing inactivity, we see the impact in our cancer-related pathways, both in risk reduction, but then again, also quality of life through treatment and improvements in survival. So this is a really interesting study, just looking at that simple factor. Again, not even worried about meeting exercise recommendation. All right, so we have just a quick question, which is, what does healthy lifestyle mean to you? So we want to take a moment and add into the chat, what for each of you individually, we know how we have a diverse audience here, right? What does healthy lifestyle mean to you as an individual? So we're going to take a moment and go ahead and add that into, I'm going to have everybody go and add it to the chat. So I want everybody to take a moment and kind of think about, now that I've talked about metabolic health and I'm starting to talk about lifestyle, now that you're here, what does lifestyle mean to you as an individual? Is it that you're thinking about engaging in healthy habits every day, the action of taking healthy lifestyle? Is it the reduction of a diagnosis of a chronic disease such as cancer or cardiovascular disease or diabetes? What does that mean to you as a person? Or as a professional? I think that's really another important factor here. I know we have some medical professionals as well.
I'm not a trained medical person. I'm just an ordinary person. Lifestyle medicine means everything to me, from birth, your total life, which I'm saying that this is something that's for the total life. That there's so much that can be done without being a trained medical person.
Definitely. Thank you so much. Okay.
I'm glad that lifestyle medicine is making it verified with peer review now. That should make it easier for us ordinary people.
I absolutely agree to that 100%. Thank you, April.
Yes, we have more hand raises. Let me know. Please go ahead and ask your question. We have activated mic for you.
Dorothy, I'm going to have you go first. If you can unmute. All right, well, let's go ahead and wait as we get Dorothy. Curtis, do you want to go ahead? I think technology's given us a run for our money today. Juliana. How about we give you a go? If you aren't sure how to mute and unmute in Teams, it's the little mic button. I know it's a little bit different. You don't see mute or unmute as you would see in Zoom.
So you need to click on the People's tab and then click on the microphone button to unmute yourself.
I think we're having an lot. All right, you know what we're going to do? We're going to move forward, but we're going to table this. So don't
Yes.
forget your question. And then we'll
Yeah.
hopefully have some chance to come back to it at all. But thank you all for hanging in there with me. Luke, do you want to go to the next slide for me, please?
Yes, please.
Fantastic. All right. So as we move forward, all right, we're going to take a minute. I'm huge in anytime we have to sit for extended periods of time that we should all try to avoid inactivity. So anytime I show up at a meeting, I have two things that I try to do. One is my 1 minute activity, sort of exercise. And then another one is a different type of activity that we're not going to do tonight called a Tabata, but I have a resource for you as well. So it's really important that we try to avoid long periods of inactivity. So I have my little image in the middle. This is what's known as a brain EEG, looking at the stimulus in our brain that happens when we sit in meeting after meeting after meeting or hour after hour after hour. This was actually done in the corporate world. I'm pretty sure this was done at Microsoft, if I'm correct, looking at the ineffectiveness of having back-to-back meetings. So you can see that if we don't have breaks of movement, our brain waves slow. This is really important when we're working with people with chronic diseases and neurodegenerative diseases that really struggle with focus and energy, that these hours of sitting, doing nothing or engaging in mindless activity actually really doesn't help our function. So here's what we're going to do. We're going to take 1 minute together. I'm going to have everyone roll your shoulders back. I'm not really in a great place to stand up and I don't want to lose my video. So I'm going to do seated. So I'm going to roll my shoulders back. I'm going to reach my arms all the way. I'm going to go ahead and lean to my right, your left, right? So you're going to lean over, looking at my little video, up to the center, opposite side, bring those arms down. I want you to rotate side to side. Keep going. Good. Big reach up again. Lean side, arms down. Now, I can't see your feet, but pretend I can. I want you to pull your toes up, put your toes down, pull your toes up, put your toes down and up and down. Now, I still can't see you, but I want you to squeeze your belly button, squeeze your booty. So squeeze your hips and your booty that you're sitting on and relax. Now, if you notice as I squeeze, notice my shoulders pop up. Yours should too. And relax. We're going to do one more and squeeze and relax. Perfect. So these little moments of movement really make a big difference and actually helps us with our metabolic health because I'm engaging skeletal muscle. So great job. I encourage you to do that in all of your meetings. Let's move into some of the other components of our talk today. All right, so what are the 6 pillars of lifestyle medicine? I keep talking about lifestyle medicine. I see some names that I know here. So I know some of you know lifestyle medicine. I created my own little images. For those of you that know me, you know that I have a golden doodle named Ruth. Ruth is pictured here in a couple of my favorite pictures under lifestyle medicine because not only is she a fun piece of lifestyle medicine, she represents lifestyle medicine well. So there are 6 pillars of lifestyle medicine, and when we're thinking about it at its functional side of this therapeutic behavior change. So we want to think about a whole food, plant predominant diet, regular exercise and physical activity, having regular stress management, good sleep health or good sleep hygiene. I like health over hygiene when I'm looking at sleep. Strong social connections and social engagement, and then avoidance of unhealthy habits. In pure lifestyle medicine, we know this as tobacco cessation and alcohol, but in the cancer space, we also add physical inactivity and sugar-sweetened beverages. But here I'm sticking kind of to the basics of alcohol. So go back to my slide. If you think about not that we're going to go back, but if you think about the slide that we had earlier, we talked about physical inactivity. That's really actually falls under the unhealthy habits part of lifestyle medicine. So these are the 6 pillars of habit and behavior change. Great. So, where is the evidence under lifestyle medicine? Well, the American College of Lifestyle Medicine, which is the 6 pillars, is the first slide that I kind of showed you. But it's really important in the cancer space to know what the recommendations are from the American Institute of Cancer Research and the World Cancer Research Foundation. What are their cancer prevention guidelines? What's important to note about the cancer prevention guidelines, they are the same as what we would term to be survivorship guidelines. We want people after cancer to resume the same habits. So these are a little bit of an expansion of the 6 pillars. They include things specifically like be at healthy weight. We include limiting consumption of fast food or processed foods as a risk reduction or prevention guideline. We also talk about things about supplements that shouldn't be used just for cancer prevention. This doesn't discredit the use of supplements, but what we are saying from these guidelines is that supplements cannot prevent cancer, but they can be a useful and beneficial part of a healthy lifestyle. So why are these guidelines important, and why am I bringing them up? If you can go ahead and go to the next slide, I want to share some of the tools or some of the research here. So how important is lifestyle? What is the science behind this? Well, this is just a snapshot of a few of the research studies that have looked at adherence to these guidelines from AICR, WCRF, the ones on the previous slide, and actually how they change outcomes related to things like survival among older adults, reducing the risk of recurrence related to specific types of cancer, such as breast cancer or colorectal cancer or even prostate cancer. And although these are just a few snapshots, we are starting to see more quality studies, both observational and now randomized control trials, showing that adherence to these healthy lifestyle habits actually reduces our risk as well as improves outcomes related to survival in cancer, as well as other chronic diseases, which I'm just not even going to be able to get into now. So I think it's important to reiterate, this isn't just a nicety. All of these aspects of lifestyle really are a necessity. And again, we'll send out the research links to all of these in the after webinar information that comes out. All right, so next, we're going to try this one more time. We have another little audience poll here. And I think this is really one of the most important ones. I'm going to kind of turn the mic over to you and see if you can unmute yourself. And we'll take a moment here. Hello.
The barrier is that it is sad that it has to come to that high level for people to promote lifestyle medicine, because we were trying to live correctly all along and we needed the support where it does not exist. So now it's for us to connect to this lifestyle movement and benefit from the professional movement.
Yeah, I think that's an excellent point. It is still, it's like you said, you hit on a really key word here. It is a movement. And I think that is connecting the dots. I think one of the things that's really fundamental is having shared language that fit not only medical professionals, but cancer survivors, caregivers, advocates of this healthy lifestyle, whatever pillar that may be. I honestly think we don't always share the same language, or we don't always agree on what's exactly the right way. And often that kind of creates this disjointed conversation. So I think it's really important that we agree that there's no perfect perfect definition of how to do this, but we create these conversations so that everyone, to your point, who's trying has access. And I think that's one of the most important things that I believe as a lifestyle medicine professional. I want it to be accessible to anyone, no matter where you live in the world, no matter what your financial situation is, your time availability is, or your support system. So I think that's one of the key things about being here tonight. So thank you. That's really helpful.
Thank you so much. This is a great question. I'm also personally a physician by training, but then pivoted and got my diploma in lifestyle medicine because I felt that there was a gap. in terms of, so I found that a lot of people were looking for lifestyle interventions to manage their chronic disease or cancer, whatever it be, but they were so overwhelmed and didn't know where to start. And it was like, oh, do I start exercising? Do I start eating? And then you clean out your closet, you buy all the new clothes, you clean out your kitchen, but then
Yeah.
it's so overwhelming. And then you end up at the doctor's office, and it's equally overwhelming for the doctor that might not understand all of the evidence behind it. And they too are spending time, on the internet looking up individual handouts or individual resources. And so I think for both groups of people, those delivering care and those receiving, it's very overwhelming. But I don't think anyone is really arguing the benefits of it, especially now after the pandemic. But yeah, it's taking it to that next step of how do you actually take it step by step and follow a plan sort of thing. I found that to be the most challenging. But in my journey,
Where do you start?
I found my own little group, and then, the College of Lifestyle Medicine and the company where I work now, my Viva, we found a team. And I think it's important for us that are implementing it to sort of spread the word and get everybody on the same page so that we can make everyone's lives easier. But yeah, so it's sort of, where do you start and what plan do you follow, or, what's the structure, or when to abandon structure. So yeah, that kind of thing.
Have you seen the cancer toolkit yet?
Yeah.
Okay.
Yeah.
It's part of our resources. So yeah. Well, and I think you bring up a really good point. I want to say, like, especially with cancer, there's sort of like this teachable moment, people say, but at the same time, it's like, we don't want to give somebody everything. We want to give them something. And where do we start? And there is no perfect, but it is starting. It's like what I tell everybody. Again, 21 years of doing cancer exercise, people say, thank you. For the audience here tonight, or today, it's really thinking about, again, the different interventions. But I think the metabolic health side is something that I don't think we emphasize enough of how critical this is to every ounce of our being. So really briefly, how do we start to implement it? Well, I have 3 areas that I think are really important to implement. This is an example related to exercise, and physical activity is just one pillar. Most important to think about, starting with education. What are the whys? I think it's really important that people understand the whys of each of the pillars, why they are beneficial, both to how we feel day to day, but then also, what is the science behind the different pillars? Some of them have more science, some of them have less science, but starting with education and exercise, we tie it to things like function, quality of life, or side effects. Giving people empowerment and encouragement is really key. Introducing conversations, whether that comes from us as providers or patients, and creating this engaging conversation, emphasizing what people can do versus what they shouldn't do, I think is really important. I think we know what we shouldn't do as humans, but sometimes I don't want to be told what I shouldn't do. Maybe starting with what I should do really can be very beneficial. And this is exactly what we were talking about just a moment ago. I always say, don't let perfect be the enemy of good, meaning I don't care if you meet exercise recommendations starting out of the gate. Would I like to get people there? Sure. But let's just start. So that empowerment and encouragement is key. If you are in the healthcare side, or you're a healthcare professional, a wellness professional, it's really beneficial as we provide resources and referrals to think about, if people do need supervision, as an example, related to exercise, or they need to have a clinician for a specific disease, we should recommend it. But we also need to ask individuals, what are their preferences? What are their motivation? What are their barriers? If we tell everyone they need supervised exercise or need to meet with a functional dietitian, but they don't have the financial means, those are individuals that will never engage. And I think that's really important when we think about creating care for our patients as well as our providers. And lastly, it's, I think, very beneficial if we can make direct handoffs whenever possible, both in referring to a specific individual, if we have that, passing that information along, or giving someone at that point of care a referral or a resource versus sending them off into the internet, sending them off to ask other people. I think this is really beneficial if we have those resources. let's continue to use them even if they're not perfect. Okay. Let's go ahead and go to the next slide. So I really think it's important to think about motivational interviewing and behavior change. We utilize a lot in the clinical side of things, what's called the 5A's framework. This is ask, advise, assess, assist, arrange. This is a behavioral change strategy as we are implementing this conversation, recommendation, and referral. So asking someone a question about what they're doing or what they want to do, advising them with information, giving them that, why this is so important, giving them this connection is really beneficial. Assess where people are. Ask them if they've had experience. Ask them what their barriers are. Ask them if they like to exercise, if they've ever tried meditation, how's their sleep. These are all really important aspects of behavioral change, interviewing and implementation. Creating assistance or connection is key. And then if we can, again, this warm handoff is the arrange. So these are the 5A's framework that are used mostly in tobacco and smoking cessation, but are part of the resources that we have developed in lifestyle medicine. So I have here some ideas for patient-facing implementation. I'm going to move over these pretty fast just in the interest of time with where we are today. These are sort of some of those kind of key things when we're engaging in conversation with individuals. So whether you're doing patient-facing implementation in a clinical or community setting, these are some of the tips that I recommend. I think one of the most important things that I will really encourage people to think about is an example. Provide personalized recommendations versus general guidelines. Great example. Plant predominant eating. What does that mean? So if you are working with someone and you're going to say, one of the pillars of lifestyle medicine is plant predominant eating, give people examples of that. Maybe it's related to beans and legumes, fruits and vegetables. Are there other types of plant-based dairy products? What are those specific things so people can start to get that framework? Same thing with, say, stress management. We tell people to stress less, but we don't always give them very specific things. So I think it's really important when we're implementing to give one small nugget of truly helpful information versus a generalization that they can get from the internet or from their neighbor. So I think this is where we can really excel as professionals. Again, don't let perfect be the enemy of good. Let's give them one thing and start the conversation. If they come back and say, well, I don't like black beans, let's try a different strategy, but let's start with something that people can gain that framework on. And then we're going to move into the last slides after that. For the clinical side of this, I think it's really important to think about if you were in the clinical side. I really recommend probably two things very specifically within clinical. One is documenting in patient notes when you are making these recommendations so you can go back to them as a clinician. It's really hard to remember what we do day to day. I'm not running a clinical practice anymore, but when I was working in clinical practice and seeing patients, I would make notes so that when I saw that patient again, and they told me that they wanted to get stronger because they were really having a difficult time with stairs to do their laundry, I could go back and ask them how they were doing. That was a very useful thing for patient connection and follow-up. And then also have patient-facing resources ready to go. Even if you don't cover all of the aspects of lifestyle medicine and metabolic health or weight management and obesity, have something ready to go that you can give to your patients so you're not having to find that information can be really key, and want to share one of those resources with you here today. So let's go ahead and move forward. All right, so I mentioned this, we heard a little bit about this. For those of you that are not familiar with the Lifestyle Medicine Cancer Toolkit, I added a QR code here that you can scan to have access to the patient-facing side of this. Under the 6 pillars of lifestyle medicine, we've created 3 intervention tip sheets. They're actually in one document, but for somebody that's looking for behavior change in moments to minutes, they can do the dip your toe in. If they want to do it in like hours to days, they can do the wade. We call this, wade in the shallow end. And then this one last one that you see here is dive all the way in. This is for somebody that's saying, I really want to strive to meet those exercise recommendations. I really want to go all in on my sleep health. These are resources that you can utilize in your patient practice your community health program across the globe to be able to give lifestyle medicine interventions at that point of care. So you can access these. If you are not an ACLM member, you can set up a free account to download those. But just so you know that you have access to those. Let's go ahead and move forward. We also have a couple of other resources here. So I do see one of my fellow friends from one of these resources on this webinar, but two main things. If you're looking for cancer exercise directory, the American College of Sports Medicine does have a moving through cancer exercise professional directory. They are starting to expand this across the globe. For some of my global friends here, we are adding people across the globe through this directory. And there's also a handout that can be downloaded from Moving Through Cancer, which is exactly what you see on your screen in the middle. It is in English and Spanish. You can give this information. If you're looking for an exercise series, this is an exercise series that I developed with an amazing organization called Living Beyond Breast Cancer. It's 9 exercise videos, shows lots of different levels from chair-based to fully functional. Anyone can follow them. I promise you they can be easy or challenging. It just gives you a great tool, but these are really our focus if you are working in the breast cancer prevention survivorship population. And then if we can go ahead and go to the last one. I also have a lifestyle medicine virtual program, which is a 12-week self-led program that individuals can engage into utilizing the evidence-based behaviors into a format that they can learn how to eat on a budget, they can engage in recipes, they can have exercise, they get all of the pillars of lifestyle medicine, and really created this for a diverse consumer base. We have piloted this program across really the United States, from the urban South to kind of a more higher income urban area, and have really realized that some of the barriers are the same, yet we need to create access for all of those members. So we created also a special discount code for this particular event that creates a 10% off of this, and you can share this with any of your patients. They get lifetime access to this program, and you can scan that QR code to find that information as well. And again, we'll send all of this out after as well. And then lastly, if you want to just go to the last slide, I have my last comment here that I want to share with everybody, which is, I think it's really important that we take care of ourselves first, our body and mind, because it's the most important job that we all have. It's the only place that we have to live. So even if you're not interested in maybe exercise or not really worried about stress management, whatever you can do to take care of yourself, consequently your metabolic health, is really important. If you have questions, I've also provided my information for follow-up. With that, we are right at the final aspect of our hour that we've asked you for your time. So we are going to stay on here for anyone that wants to have any other comments or conversation. I want to thank Aluk for hosting me, and we look forward to seeing you at future events. Aluk, I'll pass it back to you.
Absolutely. Thank you so much, Sami. That was really brilliant. Ask your question. Your mics are on, so please go ahead and ask your questions. Sami will provide the answers.
So Paul, do you want to go ahead and ask your question?
So I see a perfect fit and synergy between the objectives of lifestyle management, lifestyle medicine, and the objectives of the industry that I work in, and that's pharmaceuticals. Yeah.
Okay.
So I kind of wanted to ask, have you had much interest from the pharma world in the movement you're trying to create? And if not, why not? Because having worked on chemotherapies in the past, I know firsthand that our patients experience like gastrointestinal side effects and problems, and ideas like modifying your diet, to me makes perfect sense, right? So I kind of wanted to find out if there's been have the pharma industry woken up to lifestyle management, lifestyle medicine?
I'd be happy to take that. I would say the pharma industry is not against it. I think where people really, are hopeful is everyone's like, well, why doesn't pharma, fund this? And I think there's a couple of things that I would say to this. I really believe that, pharma has, and especially in oncology, I think this has happened in other chronic diseases, has really started to engage and focus on side effects right? Like side effect management. And understand that, like, especially the really the basics of lifestyle medicine are beneficial, right? You know, we know, and I didn't even talk about gut microbiome here, like just because of the interest of time, right? We are starting to understand like the importance of gut microbiome. We're seeing science. There's a new field called oncometabolics, looking at healthy, you know, like if someone has a healthy gut microbiome and a healthy immune system, is immunotherapy going to work better? Well, that's need to remember that pharmaceutical companies, as you know, I mean, they are in the business of making cancer treatment or other drugs for these purposes. So I don't think that they're against, but I don't think that they're going to always fund what I think people are perceiving as they should fund. Because I think that they're not against one another, but I don't necessarily see that pharma is going to fund a lot of these types of interventions, right? But I think as we continue to open up conversation, and like my pharmaceutical colleagues have been very open to thinking about how can we use lifestyle medicine support in conjunction with when we're giving side effect management on a drug, and that these are beneficial. But I don't see them happening from a company perspective. I see them happening from the industry representatives, perhaps such as yourself, our physicians, those kinds of things. I have actually spoke on this a little bit, but I don't think until the oncometabolic side progresses that we're going to see much change. And I just think it's timing. You know what I mean? But there hasn't been a lot of like, oh no. The other thing that's really interesting, so I do pharma work and have done pharma work for the last 6 or 7 years with patient education. Regulatory restriction means we can't be prescriptive on much of anything. So you can't give an exercise program. You can only say exercise is good. You can't even really give like a strength training recommendation, even though we have evidence of strength training. So I think that the regulatory side of that is also going to hinder lifestyle medicine recommendations to do it broadly. But again, I don't think they're opposed. I like physicians. I mean, generally, even my non-lifestyle medicine physicians are open. But they're like, I don't know how to do this. So anyway, long-winded, but does that help?
No, Sami, that's great. Keep doing what you're doing. Pharma will wake up one day.
Yeah. If you, I'll tell you what, if you have a thought on how we can engage a conversation, I'd be happy to share with you what I've done in industry. And if you think there's a path, I would definitely love to pursue it.
Okay. Much appreciated.
Yep,
Thank you.
Yeah. Thanks for joining. Absolutely. Okay. Didi?
Hi. Hi, Sami. Can you hear me?
Hey.
It's
Yes.
It's Darcel.
Darcel, how good to hear your voice.
Good
Welcome.
to speak to you. Thank you. Sami, I just wanted to find out, in the My Shift program, does it only focus on the weight loss, and how does it work for patients with peripheral neuropathy and those other side effects? How would it benefit? Is that also covered in the program?
Yeah, great question. So although we are talking about weight management, really Shift is really from a consumer side targeting metabolic health. But because a lot of people are looking for healthy body composition, that's kind of what I would say the B2C side, the consumer side. But it's really all the metabolic health side. So, you know, even somebody that doesn't care about losing weight but wants to be more metabolically healthy, that is really what the principles are. From a neuropathy side, neuropathy is mentioned somewhat, but rather than mention all of the specific cancer side effects, we've just created the components of an exercise platform, including balance, strengthening, that would be modifiable or appropriate to individuals that would have balance challenges related to something like neuropathy. Yes.
Okay.
And then we are launching kind of the exercise. There's going to be a separate exercise piece launching in the fall, but yes. It will accommodate, even though we aren't going to say, here's the neuropathy exercises.
Okay.
We wouldn't. Yeah. Does that help?
All right. Yeah. No, thanks. Thanks, Sami.
Yeah, of course. Great to hear from you. Thanks for joining.
Thanks, Sami.
Yep, you bet. Okay. Thank you. Did you have something you want to add? You're back on mute.
You mentioned
Great.
like the role. You mentioned the role of the regulatory standards.
Yeah.
Like the patient has a lot of freedom to become educated and to choose things. And for example, access to food. Like the farmer cannot say that he's selling food as medicine, but the patient can buy food as medicine and
Right.
is not hindered. And so if I'm linked with the correct information, for example, I did the gift of health training, so I have the correct information to promote a food as medicine project, because as the patient, I have the freedom of speech and the freedom of association. So there's a lot that the patient can do when we are properly supported. So
Yeah.
I just need somebody to set me up for success. And then when I'm
Yeah.
set up properly, I can reach a lot of people. And for example, the doctor is charging $15,000 for 1 year of support, and I charge $197 for lifetime support, because this is to make sure I'm getting it to the people who really need it. And we are studying together. I'm not teaching anybody anything. We are studying materials together. We're like study buddies. Does that make sense?
Yeah. I mean, I think, and I know we've exchanged emails. I really believe that the path forward is going to take a very diverse group of professionals and patients, policy change. I mean, there's room for all of us, to really make change. It's going to take this kind of momentum. I think, one thing to think about is, how do you align or partner with someone that may be offering something, like you said, from the other, perspective. I think your involvement in ACLM is a good starting place, just to kind of keep having those conversations. I think some of these professionals, I don't think they disagree with you. I think they need to learn how to better utilize you, and you need to keep sharing what you offer, because I think they will use you. They just need to get more familiar with you. The regulatory in pharma is just, the rules are set for reasons that aren't meant to be limiting. They just are. And they are for reasons, I think, as an example, the same reason that we can't give all of the pharmaceutical companies can't give all of the physicians big parties, and, can't do those sort of things, because it's that, what is the word that I'm looking for? It's called the Sunshine Law. Anyway, because they can't buy their prescription, so to speak. So I think that's, to your point, April, is hindering some of these things. But I really believe that physicians want to align with people like you, because they see the care that you provide. They can't always provide because they're too limited. So I think we just keep moving forward and keep working on this stuff together.
So then my barrier becomes that nobody's familiar with me. That's what my barrier is. I'm always a stranger.
Yeah, I get it. I've been at this 20 years, and I mean, it is one conversation at a time, but the momentum will get there. So, I mean, I don't want to discredit that, but I just really encourage you to keep engaging in conversations and keep showing up to things like this to build who you are. And I think it will continue to happen.
I would like to thank everyone for joining today. Sami, you were wonderful today. And thank you so much for joining. We look forward to having similar sessions for everyone. Right. So with that, one important thing which I definitely would want to mention is we have done 2 of episodes on podcast, and our podcast is called Fitness Pro Chat, and you can find it on Spotify. You can find it on Apple podcast. One episode number 28 and episode number 31. One is on living with cancer, and the next one is on metabolic health and cancer, where Sami and I have discussed at length about metabolic health and how it impacts our entire synergies in the body system, especially related to cancers. We'll also share the recording of today's session with you all, along with all the resources and links and QR codes, so that you have everything from us in your inboxes. Please feel free to visit Fiterobic, that's F, and feel free to reach out to me and Sami on LinkedIn and other social media channels. Thank you so much for joining today.
Thank you, everybody.